exercise of canal wall down mastoidectomy can now begin after you have done a complete posterior tympanotomy. You must understand that for a canal wall down mastoidectomy to be complete, the posterior canal wall must be completely removed. Here we are making a cut along the outer wall of the attic and then another cut along the floor of the posterior canal wall, which is an extension of the already operated posterior tympanotomy, and then the posterior canal wall is removed. This technique can be used in conjunction with an extended facial recess approach. Now, once the bone is removed, then the whole mastoid, including the middle ear, becomes one single cavity, thereby allowing for easy access and drainage, and can finish in a completely epithelialized, well-healed, self-draining mastoid cavity. This is how the canal is removed. This technique has already been described in a sleeve resection of the temporal of the external aortic canal. Now you can all see the incus in the stapes is already removed. The malleus head is present. The floor of the external aortic canal is now made flush with that of the posterior canal wall. The same is done to the scutum to make sure that there is a slope that extends into the attic. Access to the anterior attic is limited by the head of the malleus, which is now cut away by the detus malleus nipper. You can leave the handle of the malleus attached to the tympanic membrane remnant. Now, drilling is done in that area where the supratubal recess is placed. Complete canal wall down mastoidectomy should mean that the eustachian tube orifice into which the probe is going now, which you can see in the picture, and the supratubal recess lies in one plane without any ridge in between. So that is the semicanal of tensor tympani and the remnant of the tympanic membrane. Facial nerve has already been decompressed in the previous exercise. Ossiculoplasty at this level can be done by making a vertical strut of either cartilage or the incus. The incus is being shown here. You have to create a groove and a portion which lies on the foot plate. So here the incus is placed on the foot plate and the groove is placed underneath the handle of malleus. This completes a canal wall down mastoidectomy in a patient who does not have an intact stapes.